Arm lifts are a very common procedure that we do. An arm lift, or a brachioplasty, which is the medical term for it, is pretty much what it sounds like. It's taking extra skin and fat of the arm and removing it to give a more sculpted, lifted, sleek appearing arm. However, this surgery is a little bit misunderstood, and I think it's a little bit different than other plastic surgeries, so there are some key points that I want to make about it. The first one is, who needs an arm lift? Who needs a brachioplasty? So a lot of times, if someone's coming to me and they are on the younger side and they really just have some extra fat on the arms that they don't like, they are actually a better candidate for just liposuction alone. Liposuction uses very small incisions, it suctions out the extra fat, and then the skin, if it's of good quality, will usually snap back to a smaller size all on its own with no actual excisions needed. However, patients that are older or patients that have lost a lot of weight, they oftentimes have extra skin as well as extra fat. And so for these patients, you do have to do an actual skin excision. The incisions themselves can vary. There is what's called a short scar brachioplasty, and that's where there's a small scar that's placed in the armpit, so very well hidden. And then there are the more extended versions of a skin excision, which involves an actual incision under the bicep here, all the way down to the elbow. Obviously a much more visible scar. In my experience, there are very few patients that are actually candidates for that short scar brachioplasty. Usually those are patients that might just be a little bit older, have some loose, crepier skin, and they don't need much. They just need a little bit of tightening, and that extra incision in the armpit is all that they need. For the majority of my patients, especially anyone who has lost weight, they usually need the full incision. So when I'm doing the incisions, my preference is to hide those scars as much as possible so that people don't see them when you're just going about your daily life. So the idea is that if you can put this incision right under the biceps here, when you have your arms by your side, you don't see it from the front, you don't see it from the back. But what you may see is when you go to, wave by or say hi to somebody, you will see that scar. So that is something that's very important to know. It will eventually be visible. And we will talk about how to maintain the scars later, but I think it's just important to know that there will be a scar. So a lot of times patients that are coming in and they want an arm lift or a brachioplasty because they're self-conscious about their arms already, maybe they never wear short sleeve shirts or tank tops, and they come in and they say, I just want to wear a tank top again, or I want to be able to wear short sleeve shirts. We will get you to a much smaller arm, but there will be a scar, and you have to be okay with that and be okay showing that in certain circumstances. So those are the scars, and I think that's the big thing that everyone wants to know about. And then there's the actual procedure itself. So the surgery itself can be done as an outpatient procedure. Depending on how much extra fat there is on the arms, there may be a significant amount of liposuction required. There are some patients that come to me that really just need to lose more weight because the liposuction on its own is not going to be sufficient. However, if you have just a moderate amount of fat left on the arms or no fat, then you are a candidate for doing the brachioplasty plus minus liposuction. The reason the liposuction and the fat burden on the arms is so important is because it affects the outcomes and the potential complications of this surgery. If the arm is large and there is a lot of fat left on the arm, it's really hard to get those incisions to heal, to stay closed, to not break open or have any complications. If there's still a moderate amount of fat on the arm, I can get after it pretty aggressively with liposuction, but it does take longer and it does extend the length and sort of the complexity of the surgery. So that, I think, is probably one of the most important things I do to make sure I have good results, is to make sure that there is as little fat on the arm as possible. And I usually have to do that by doing a decent amount of liposuction of the whole arm. That is what's going to really make the arm look smaller overall and also decrease the chances of having wound healing complications. So on the day of surgery, you're going to go to surgery, you're going to do as much liposuction as we need to do to decrease the bulk of the fat on the arm, and then we're going to make that incision. And again, right under the bicep here, usually up into the armpit, and sometimes down the length of the chest wall here if there's extra skin on the sides. And the idea is that we're really treating this whole area. And I like to do my surgery when I'm taking out the skin in kind of a stepwise fashion. As I'm going along, I'm cutting a strip of skin here, checking to see that it closes, take another strip, check to see if it closes. And at the same time, I'm also checking to make sure that the contour of the arm looks really nice. Because you don't want to have like a little bit of extra skin here, and then maybe it's tighter here, and then it's looser here. You want that nice clean line on the bottom. So that's one of the reasons I kind of do it in a stepwise fashion. And then once all the fat's removed, all of the extra skin is removed, then we spend a lot of time closing that incision in layers. That closure is very important to make sure we get that nice, beautiful scar at the end. After the surgery, you get put into arm garments. Garments are compression sleeves that you'll wear for at least 6 weeks, sometimes 3 months. And then there might be a drain as well. So you'll have your drain, you'll have your garments, and then you go on home. After the surgery, it's very important that you maintain certain activity restrictions. The most common place to have wound breakdown after these surgeries is in the armpit area here. And I think it's because it's just an area that gets sweaty a lot. It's under a lot of movement all the time. And so it's just a very prone area to have wound healing and complications. But to try to minimize that, I do ask my patients to not move their arms higher than shoulder height for the first 2 to 3 weeks. So shoulder height's fine, you can brush your teeth, you can wash your hair, but no overhead reaching for a couple of weeks. After a couple of weeks, I'll let you get back to full range of motion, but nothing for the first couple of weeks. Right after surgery, you'll have some tape strips over the incisions to protect them, make sure that they're healing well in the beginning. And then at about 3 weeks, as the incisions are improving and healing, I'll take the tape strips off and start transitioning you to different scar creams and treatments and management. And then this is where it gets really important to talk about the scars. These scars, of all of the surgeries I do all over the body, tend to heal the worst. And I hate to say that, but that's kind of just how it is. Even in patients that maybe don't have any wound breakdown issues and they heal beautifully, sometimes these scars can get a little stretched out when they can thicken or they can darken. And I think it just has to do with the blood supply to this area, the constant force of gravity pulling on it, the constant movement that the arms are doing. These scars are just under a lot of tension and stress all the time. But there are things that can be done to improve these scars. So one, right away, around 3 weeks or so, I will start suggesting different silicone strips or silicone gel that you can put on the incisions to help them heal. As we're going through the healing process, if there are any areas of the scar that are getting thick or raised, we have the option of injecting them with steroids. There's also a whole plethora of other options such as laser therapies, microneedling, V-beam lasers, ablative lasers, all things that can be done to treat scars if they are starting to become problematic. But if scars are otherwise healing okay and don't need any advanced aggressive scar therapies, what you can expect is that between weeks 6 weeks to maybe 4 or 5 months, the scars are going to go through a kind of ugly red phase. And the red is actually part of the healing. The red means that blood vessels are coming into that wound to heal it. So that's why it turns red. Then as the healing resolves, those blood vessels go away. And then that's when the change in color will come from a red to a purplish and ideally a white thin scar. The transition to that lighter colored scar can take a while, longer than I've seen on other incisions. Sometimes it's a year or more before it starts to fade. The scar will never fade completely. There will always be a scar there, but the idea is to get it to be as minimal as possible. Complications. So I've been talking about wound breakdown a lot, and that's because it happens fairly commonly. And in best case scenario, it's a tiny little area of the incision and it heals on its own in a few days. Sometimes the open areas can be a little bit larger and take a few weeks to heal. Again, most commonly they're seen in the armpit area. Sometimes it can be seen in other areas of the incision as well. If that happens, it's typically treated with an antibiotic ointment until it heals on its own. If it goes on to heal fine, then great, we don't have to do anything more with it. But if that area leaves behind a scar that is thick or widened or in some other way unattractive, we always have the option of coming back and doing a scar revision in that area. And that's a procedure that usually can be done under local lidocaine anesthesia here in the office. It's not a whole big thing. And it's just removing that portion of the scar that has healed in an otherwise unaesthetic fashion. So that's always an option for scars that we do not like. The things that you have to do to make sure that everything does heal really well: scar creams like we talked about, wearing those compression garments for 6 weeks up to 3 months, and massages. I think massages are really helpful, especially if there's been a lot of liposuction done. Where I see a lot of patients getting some deep scar tissues and fibrosis is in the back of the arm right here. And I usually do have to get after that area pretty aggressively with liposuction, so I'm not surprised that they do get a little bit more scarring back here of the deeper soft tissues. And so what that can look like if you're not staying on top of it is just a tightness in that area and kind of a difficulty with range of motion. But if you can do the massages as soon as possible and stay on top of them during your initial first few months of healing, they usually all heal beautifully and that area stays nice and soft. So brachioplasty, great surgery. You can get some beautiful results. You can really decrease the size of the arms and eliminate the extra skin. But it's a little bit more of a journey, a little bit more of a process than perhaps other surgeries. And as long as you are doing everything you're supposed to and following all the instructions, we can usually get a pretty nice scar and a nice result. It's just going to be a bit of a journey, but yes, we will get you there.